Hello everyone, this is Dr. Taposh and welcome to our channel Physiomax Organization. Again, welcome back to our medical education series of different pathological condition of shoulder joint. And as we are continuing this education series, today we'll be talking about a very important muscle, very important tendon of that particular muscle, which is to go for the injury, those who used to do a repeated movement at a 90 degrees of abducted position. The tendon which is to rupture or which is to have a impingement if you do any repeated motion at 90 degree. Example, those who are having a movement like fast bowling, those who used to throw for a long distance like javelin throwers, shot put. Again, those used to do any type of game like a bowling, they used to do the movement at a 90 degree. Even the people, those who used to hold the metro rail, and suddenly if there is a stop or a bus rail and then suddenly there is a jar, and if there is having a rotation, they also used to have this tendon injury. Again, those who used to work in a gym, for them also, if they try to weight, may just lift a heavy weight, and if suddenly the hand is to go for a further rotation or those to go for a deadlift, if the position is not proper, again this muscle is to go for the injury. Mostly for the bowlers, we used to see the bowlers used to strengthen their muscle, mostly of this muscle, before going for any type of sports related activities, because they know that if this muscle will have a weakness, there is a chance of having a inflammation or there is a chance of having impingement of this muscle. Yes, I am talking of about the most common tendon which is to go from the glenohumeral joint, that is the supraspinatus tendinitis. So in this series that we are about to start, we will understand about the what is supraspinatus tendinitis, who are more prone to have a supraspinatus tendinitis, even if there is a supraspinatus tendinitis, then what will be the symptoms of a patient those who will have a supraspinatus tendinitis, and even how can we differentiate this supraspinatus tendinitis with subacromial bursitis. And again, supraspinatus tendinitis and relation with the rotator cuff impingement or rotator cuff tendinopathy. And also we'll understand with physical examination or with few special tests how we can diagnose this supraspinatus tendinitis. So before we start, first we need to understand where is this supraspinatus muscle is. As by the name, the supraspinatus, supra means above, and as this muscle is present, just if I consider this as the spine of the scapula, this is the supraspinous fossa. So this dotted line what I have shown over here, this dotted line considered as a supraspinatus muscle. This is the passage of the supraspinatus muscle, that's how it is going, and it's getting inserted just below of the greater tubercle of the humerus. So just this is the position of this supraspinatus tendon to go for the insertion. So the most important point what you need to understand, that is this supraspinatus tendon is to pass just below, if this is the acromion process, this is the acromion process, and this is another bony prominence of the head of the humerus. So whenever we do in an abducted position, whenever the arm in a 90 degrees of abducted position, there this bone and this bone is to come in a proper place when there is a very less amount of subacromial space. And as this bone passes between these two bones, if there is any change in the position of the scapula, that mostly occurs just because of the weakness of the rhomboid muscle, then there is a impingement just below of this subacromial space, that is the supraspinatus tendon. Now, as we all know, as per the anatomy, this supraspinatus tendon is protected by a structure that's its named as a subacromial bursa. But whenever someone used to have an injury, first they used to have an injury to the subacromial bursa, and that's the time we used to tell that condition as a subacromial bursitis. But when someone will have a subacromial bursitis and it's not treated, and if they continue with that movement of a subacromial bursitis, they further lead with a supraspinatus tendinitis. So supraspinatus tendinitis is a chronic condition and subacromial bursitis is the acute type of injury. Subacromial bursitis, which is non-treated or untreated subacromial bursitis, leads to supraspinatus tendinitis. So we understood the basic mechanism and where the supraspinatus tendon used to go for the injury. Now we need to understand that why this supraspinatus tendon used to go for the injury rather than the other rotator cuff, as this is the only tendon of a rotator cuff muscle which is to pass between two bony prominence. That is the reason this supraspinatus tendon is to go for that itis or inflammation more frequent than the other part of a rotator cuff muscle. Now, who are more prone to have this supraspinatus tendinitis? The most important is the long tennis player or the badminton player. For the reason, whenever these two serve, as we know, supraspinatus tendinitis tendon, it is a external rotator of our arm. So that means this is the movement what the supraspinatus tendon or the rotator cuff they does. But whenever we used to do any type of badminton or long tennis during this game, any type of sudden movement, sudden thrust, that's mostly needed for the badminton and the long tennis player, what happens? Our internal rotator muscle, they used to do a forceful contraction, where the pectoralis, they help for the forceful contraction, but at that time the supraspinatus tendon, it landed in its most maximum position at 90 degrees of a abducted position, and that is the reason, that is the time supraspinatus tendon will go for the injury. Apart from that, a fast bowler, those used to rotate the arm at a 90 degrees abducted position. If by chance during this abducted position the scapula will rotate further, they are more prone to have a supraspinatus tendinitis. In our daily activity, whenever we used to lift any type of heavy weight, if the position of lifting it's not proper, even during a gym, those used to lift a deadlift or any type of heavyweight lifting, if by chance they will have a malpositioning of the particular joint structure, if they don't know how to lift the structure, then they might lead to the supraspinatus tendinitis. Apart from this, there is another very common what is to get a patient as a part of supraspinatus tendinitis. We also need to assess, here is another muscle, there's a rhomboid. Weakness of this rhomboid muscle, so this is a rhomboid minor, just below of that is the rhomboid major. So above is the minor and below is the major. So weakness of this muscle, rhomboid group of muscle, may lead to supraspinatus tendinitis, and this is what's called as a scapular dyskinesia. Now we might be wondering that why we are talking about this weakness of this, why might lead the supraspinatus tendinitis. Come, let us discuss about why weakness of this rhomboid muscle will lead to the supraspinatus tendinitis. See, so this is the rhomboid muscle and they helps in doing the retraction of the scapula. So how much the scapula will retract, that totally depends on the power of this rhomboid muscle. So consider if you think that you will try to throw any object, but you are having a weakness of this muscle, you don't have that much power of the rhomboid. So if this rhomboid will lose, or if this rhomboid will not able to hold the scapula particular position, this acromion process will rotate further, and the space between this acromion process and the head of the humerus, it is to reduce. That means there is a reduction of the subacromion space. So this subacromial space will reduce. As this subacromial space will reduce, and as we know, the supraspinatus tendon will pass between the subacromial space, there is a huge chance of the supraspinatus tendon to get impinged between these two bones. So we understood weakness of this muscle may lead to supraspinatus tendinitis. So we understood that who are again prone to have this supraspinatus tendinitis, and as the last part of this video, we'll understand if someone will have a supraspinatus tendinitis, what are the symptoms they might have. So the first we need to understand, as this is a muscle, they will have a difficulty in lifting the hand in a abducted position. Now why? Because we know supraspinatus helps in a particular position of 180 degrees of arc, that helps doing the abduction, where it is from the 0 to 10 degrees of initiation of the glenohumeral arc in a abducted position, supraspinatus muscle, they used to have a pain. So whenever the patient try to lift the hand from 0 to 10, they will have a pain. But once they passes the 0 to 10 degree, when again they can easily lift till the level of the 90. But at the level of the 90 to again 110 degree, they will have a pain. Why? Because again, as like 0 to 10 degree, the initiation of the abduction motion it done by the supraspinatus muscle, same like at 90 degree and 110 degree, the supraspinatus muscle is to hold the arm in a maximal taut position. That's the reason at a 90 to 110 degree also the supraspinatus muscle will have a pain. With these very classical symptoms, we can understand that there's a supraspinatus tendinitis. Of course, we are having so many physical findings, so many clinical examination that we'll be seeing in the next video. So as of we will understand, if someone will have a supraspinatus tendinitis, they will have a difficulty in 0 to 10 degrees of the abduction, and again from the 90 degree to 110 degrees of a painful arch syndrome. So for today, this much. Again, we'll continue in the next series of the supraspinatus tendinitis and its classical findings and the examination procedures. So till that time, goodbye, and don't forget to like this video and don't forget to subscribe our channel. Thank you.